Please be seated. Good afternoon, everybody, and welcome to the Harvard Medical School and Harvard School of Dental Medicine Class Day ceremony. My name is Bernard Chang, and I'm the Dean for Medical Education, and let me be the first to offer all of you a very warm welcome on this warm and somewhat wet day to our quadrangle here. Today is our opportunity to celebrate the accomplished students and soon-to-be graduates of our institutions in the presence of their families and loved ones, and as always, with the support of our dedicated faculty and staff. In a time of turmoil, there has never been greater importance on the relief of human suffering or the improvement of human health. And we are so proud to recognize all of you in the class of 2024 who have dedicated yourselves to this mission and will be joining the next generation of healers for our society. Now, we've been closely tracking the weather, and we hope to pull off yet another Harvard miracle. But if you notice that our program is running a little bit faster or going a little bit shorter than we might have optimally planned, it's because we want to make sure that all of our students are recognized and celebrated in case the weather does take a turn for the worse. The focus will remain on all of you and on the wonderful words of wisdom you'll hear from our honored guest speaker. So, in that spirit, and without further ado, it's my privilege to introduce Victor A. Lopez Carmen, an enrolled member of the Crow Creek Sioux Tribe and also from the Yaqui Nation, who's set to train in pediatrics at the University of Washington Seattle Children's Hospital. Let's welcome him to the stage now to share his reflections on honoring Indigenous peoples. Victor.
Thank you. Au, Victor Chasmatumpi, Ka, Dakota, Chaze Mitawa, Waokia Mani, Imaki Yapido, Dakota Hemacha, Hunkpati Oyate, Ita Wahanaji, Ikche, Wimachasta, Chate, Ita, Iwaeka, Tanya, Wachia Kapido. We are gathered here today on the lands of the Massachusetts and Wampanoag peoples and pay respects to their elders, past, present, and future. As an institution that has benefited from the enslavement of Black peoples and the genocide of Indigenous peoples, we must go further than an acknowledgement. As a proud member of some of the oldest nations on planet Earth, the Dakota and Yaqui, I know that this is vital. For millennia, my people lived happily, healthy, and free. Then colonization came. 247 years ago, the United States continued this genocidal campaign, forcibly removing, massacring, and starving Indigenous men, women, and children. And we still experience the impacts today in our communities. That is why I stand here as the only enrolled U.S. tribal member graduating from Harvard Medical School. Thank you. To do my responsibility to contribute to our nation's healing from generations of colonial violence and sickness, to help re-remember the pre-colonial ways so future generations can live their full Indigenous lives. And I pray the future Palestinian children can thrive in their sacred lands, nourished by the olive trees. nourished by the olive trees that will grow back stronger for generations. My ancestors fought for the people and land, speaking out without fearing the consequences to themselves. I know by their actions that they loved me. I pray the future Palestinian children and all people in Palestine will also need healing from these atrocities. Know by our resistance to injustice now that we love them too. Thank you.
Thank you, Victor. I would like to now introduce and welcome our two HMS Class Day co-moderators, Andrew Chang and Washira Nolan, to the podium.
How y'all doing? We made it. We made it, y'all. It wouldn't be our class if we didn't have a little drama, right? Good afternoon to our deans, faculty members, and speaker, Dr. Melissa Gilliam. Good afternoon as well to our exceptional facility staff, technicians, security, food service workers, and custodians who made this event possible. I also want to give a special welcome to my mother, Ty Harps. I am here because of you. And no matter how many letters are behind my name, being your daughter is my proudest and best honor. Thank you. On behalf of this class, thank you most to our family and friends who have traveled from far and wide to help us celebrate this special day.
Class of 2024, I'm so excited to see all of you here in person. Congratulations, class of 2024. We earned this. And now it is my great pleasure to welcome Crystal Son, the Harvard School of Dental Medicine moderator and one of the strongest persons that I know.
Thank you so much, Andrew, for your warm introduction. I'm honored to represent the Harvard School of Dental Medicine, class of 2024.
We doing it, y'all. Don't worry. We gonna get a hang of it. Now it is my distinct honor to introduce our keynote, Dr. Melissa Gilliam, who will assume the presidency of Boston University on July 1st, 2024. She is an award-winning interdisciplinary researcher in medicine, public health, and the humanities, and a veteran administrator, educator, scholar, and physician. Dr. Gilliam previously served as the executive vice president and provost of Ohio State University and its chief academic officer and chief operating officer. She led an academic enterprise that included 15 colleges, more than 7,500 faculty members, and over 67,000 students. Prior to joining the Ohio State, Dr. Gilliam spent most of her career at the University of Chicago, where she was a professor of obstetrics and gynecology and pediatrics. She was also the Helen H. Block Distinguished Service Professor of Health Justice and Vice Provost. Dr. Gilliam's scholarship focuses on developing interventions to promote adolescent health and well-being. Her research has been funded by the National Institutes of Health, the National Science Foundation, the Bill and Melinda Gates Foundation, the Ford Foundation, the John D. and Catherine T. MacArthur Foundation, and others, all the foundations. Dr. Gilliam is a member of the National Academy of Medicine and serves on the Board of Governors of Argonne National Laboratories. Dr. Gilliam earned her Bachelor of Arts in English Literature from Yale University, a Master of Arts in Philosophy and Politics from the University of Oxford, and her Doctor of Medicine from the Harvard University. She also obtained her Master in Public Health from the University of Illinois, Chicago. She completed an internship in general surgery at the University of Chicago and her residency in obstetrics and gynecology at Northwestern University. Dr. Gilliam, you embody excellence in every sense of the word, and we are so excited to invite you back home to HMS to share some of your brilliance with us.
Thank you. Thank you so much for that warm welcome. Thank you all for being here. And thank you so much to all of you whose labor has enabled us to have this wonderful, wonderful day. Congratulations, graduates. Congratulations. Congratulations to you and your families, your friends and teachers. This occasion is truly joyous. You're graduating in a remarkable moment in human history. You are graduating having endured a worldwide pandemic. You are graduating during a medical inflection point that promises great opportunities as gene therapy, artificial intelligence, and robotics will lead to breakthroughs we could not have imagined a decade ago. You are also graduating at a troubling time when hatred is on the rise and democracies and democratic values are under threat. And yet, you have chosen a life of service. So how does one serve at this challenging and beautiful time? I'll offer you the principles that guide my own life of service. Love yourself, love one another, and love mankind. Loving yourself means fulfilling the promise of your abilities amidst all that you will encounter. Please understand the gift you have been given. You are among the very small number of people in this world who have the privilege of advanced education. So few have this opportunity, and so few likely will. The 2030 Agenda for Sustainable Development, adopted by the United Nations member countries in 2015, provides a shared blueprint for peace and prosperity. Goal 4 is quality education. In 2021, before the pandemic set us back even further, worldwide primary school completion was 87%, and only 50% of young people completed upper secondary education. Ability is equally distributed, but opportunity is not. My own family's example is instructive of the transformative potential of education. My mother, Dorothy Gilliam, grew up in Louisville, Kentucky. Her father, who was a minister, instilled in her the value of education and human possibility. After he died, her family struggled with poverty, and she left her college when she was 16, determined to be a journalist. In 1957, age 20, she watched L. Alice Wilson, her boss, as he covered the integration of Little Rock High School for the Tri-State Defender. After watching him fall to the ground during anti-integration violence, she convinced a seasoned photographer to drive her to Arkansas so she could cover the ongoing story. Her belief in her ability led her to Columbia School for Journalism, where she would be the only Black woman in her class, and then to the Washington Post, where she would be the first Black woman reporter. Being a reporter at the time was not easy. Her colleagues would cross the street, pretending not to see her rather than greet her in public. To file a story, she would stand at the bus stop and write her story in shorthand, because no taxi would pick her up, but she knew she had to have it in by the deadline. But she endured. She knew there were stories that only she could tell. When she moved to Washington, D.C. to start her job, my father, who had just completed art school in Louisville, followed to begin his career as an artist. He began painting at home and then, with a grant from the National Endowment for the Arts, bought his first studio. While most artists of color were making figurative political paintings, he was drawn to the techniques of the Washington Color School. Kenneth Nolan, Gene Davis, Morris Lewis, a group of artists who painted beautiful colors on unprimed canvases, demarcating lines of color with raw canvas clearly visible. His friend Tom Downing told him that his color paintings were good, but his watercolors were his best work. So Sam began to soften the hard edges between colors, let the colors meld. Then, like his heroes, John Coltrane, Miles Davis, he began to improvise. Why must paintings be flat on the wall? What if they hung from the ceiling? What if the canvas draped a sawhorse? If he did this, then paintings would be sculpture. That inspiration would lead him to redefine abstract painting and become the first Black person to represent the United States at the Venice Biennale. The year was 1972. His belief in himself as an artist carried him from his birthplace in Mississippi to the walls of the major museums in the world. The thread here, and what I want for you, is a love of self that is so strong and so passionate that you fulfill your abilities. If you do, you see new things, you think new things, you follow hunches and inspirations, and at moments when I am confronted by a world that often seems broken, I think about these two young people starting out before the civil rights movement was fully formed, digging deep and moving forward. My parents, having established themselves, enabled me and my sisters to move through our own education with confidence. I majored in English as an undergraduate and then spent 2 years living and studying abroad. I studied philosophy and politics, which somewhat paradoxically strengthened my desire to enter academic medicine. When I landed in Boston for medical school, my possessions were still in transit. As a member of the Canon Society, my last name, Gilliam, led to my locker being placed next to another Canaanite with the last name of Grobman. Bill Grobman was kind enough to lend me a sheet and a pillowcase when I had neither. I imagined the Harvard administrator who gave me my locker assignment and alphabetized my partner for almost everything: anatomy lab, histology, patient doctor. 34 years later, Bill is still my partner for everything. And his support has been crucial as I've moved through the different stages of my life and career. I tell you this story in the context of your last 4 years. When you have worked so hard and studied for so long, think about how much knowledge you have gained and how many hours you have spent in that quest. You have discovered abilities that you did not know you had. You speak new language, words like Bezor and satiety and caries, they roll off your tongue. To push yourself when you are very tired, you will tell yourself that you are strong. You do not need sleep. You do not need food. You do not need to sit. You do not need to rest. But one thing is for certain, you do need other people. Without the support and comfort of your relationships, it's just not a long-term strategy for achieving your goals. So my second message to you is love your family and friends. And really, that is not enough. It is easy, mostly, to love your family and friends. But I would challenge you to seek to love people who are not known to you, and even more so, who are different than you. If we are going to care for people, then you must see people and hold their humanity in the highest regard. Be on the guard for the trap of othering that is all too easy to fall into. Homophily, love of things that are like you, holds a strong pull. How do we love one another given that the fear of other is so deeply rooted in our nerves and psyche? This is a challenge I will dwell on from here on. I have been that person who has failed to see and understand my patients. I recognized this early in my career as I conducted my first research study while a resident at Northwestern. Pregnancies less than a year apart, rapid repeat pregnancy, carries significant risk for families and their offspring. I wanted to see if a high-quality counseling intervention alongside birth control pills could decrease rates of rapid repeat pregnancy among first-time Black adolescent mothers. I designed a postpartum clinical intervention using what I conceived of as best practices. I then followed the participants longitudinally, and I raced around to meet each adolescent mother during her postpartum visit. But slowly it dawned on me that there was a very high no-show rate among adolescent mothers, and yet this 6-week visit was a cornerstone of postpartum care. As I reached out to them and talked to the patients who did not return, I got snippets of their daily life: a broken elevator, getting kicked out of school for being late, losing electricity, the list went on. You understand these factors as the social and structural drivers of health. I realized the project, as I initially conceived of it, needed to be revised. If I had not had the opportunities to hear from the people for whom we care, people who were having lived experiences different than my own, I would have patted myself on the back for completing my project, but never really have helped those I most wanted to. I have also been the person who has felt mistrust of clinicians. I spent much of my career at the University of Chicago on the south side of Chicago, the most economically challenged area of the city. My Uncle Coolidge lived nearby. As he aged, he developed COPD and coronary artery disease. Uncle Coolidge had a wonderful relationship with his primary care doctor, but often got admitted to the emergency room. My cousin Brenda, who is a nurse at another hospital, and I had a routine. She would page me when he got admitted, and if I could, I would grab my white coat and stethoscope and run to his bedside. I was standing guard. I wanted people to anchor their judgment and medical decision-making with my white coat in mind, as if, yes, this is your colleague. This is your colleague's family member from our surrounding community. I'm sorry, not a nameless, faceless person from our surrounding community. My worries were unwarranted, but we need to recognize that when we care for people who differ from us, there is a risk of inequitable care. So I challenge each of you to keep that in mind as you go out and care for people. I know that every day you will go to work wanting to get the very best outcomes for each person you will see. To do that, you must be aware of the forces that will work against you and move not just to listen, but to hear. Really hearing someone can be life-saving. I had my first child as a third-year resident. I had spent so many months caring for high-risk pregnant people that when the baby was born, I breathed the biggest sigh of relief. About 10 days later, I had my first day alone with a new baby and began to run much-needed errands. My usually calm baby cried loudly, and then not at all. We arrived home, and he seemed so docile, and I thought it was really odd because he was usually really playful. And so I called Bill, describing my worry about these really just non-specific findings, and he said, trust your gut, call the doctor. And so when I called the pediatrician, she listened and she said, go to the emergency room. And with her validations, it was like the pieces just fell into place, and I flew. And things really, really were wrong. He was in an SVT, and soon after that, we were in the ICU, and he was intubated and on pressors. And I even learned that they had called the ECMO team, thinking maybe they could just buy some time for him to recover from shock. They were finally able to convert him to sinus, and Ben is now a perfectly healthy third-year Harvard Medical student. Thank you. So later, I asked my pediatrician why she knew to send me to the ER. And she said, I watched you, and I knew your temperament. You are a calm person, so something must have been very wrong. If my pediatrician had said, come to the office, there is a respiratory virus going around, which there was, or dismissed me as another over-anxious new mother, we would have had a different outcome. So as my career progressed and these relational challenges began to increasingly weigh on me, I left the science lab and I went back to my roots in the arts and humanities. I began to imagine a different way to conduct my research using humanistic practices to bring young people into the research process as co-designers. At first, honestly, my ideas were met with a lot of skepticism and at times ridicule. But I drew on that skepticism to up my game. I collaborated with colleagues from across the institution. We got grants, we wrote papers, you heard about all the foundations, and the work flourished. Through storytelling, we worked with adolescents on the south side of Chicago and in urban slums in India. Through game design, we met tech entrepreneurs and launched a startup. With design, we have helped young people have agency both within and outside of the healthcare system. Yet this is not a career filled with victories. I'm only too aware that the issues of justice that I have committed my life to, whether it be reproductive, racial, economic, environmental, are not only very far from being achieved, but are constantly challenged. Yet the path I am on is not measured by wins and losses. It is a personal path, an internal struggle in which I aim to live life without malice or fear of anyone or anything. So setbacks do not weaken my resolve, and they should not weaken yours, but only service to strengthen it. The path you are on starts with a love of self, the continuing desire for knowledge, the support of your family and friends, and the commitment to improve the lives of others. Do not worry where it will take you. Mine took me to English literature, philosophy, politics, medicine, public health, and now I will leave the practice of medicine altogether to use other levers to improve the health of people and the planet. And so the last piece of advice I will give you is the one perhaps you may think has the least to do with medicine at all. Read widely. Doing so will help you to understand the world, express yourself, and contribute to the scientific literature. It will enable you to think critically and honestly about the human condition. When we read literature, we are transported to new times, places, and ways of seeing. We learn to appreciate nuance and detail and beauty in both the complex and the mundane. Along my way, I met Rilke, who taught me that even as a learned poet, you write back to the young aspirant. I met Eliot, whose politics I dislike, but whose poetry has taught me so much about silence and music and waiting. From the late John Lewis, I am reminded of a beloved community, and the Reverend King reminds me how long the path will be. My late father is still with me and reminds me that art and music are among the highest callings. In our professions, we will make mistakes, we will save lives, and we will have complications. We will often make a difference, but sometimes we will fail to make a difference. But if we see one another's humanity and hold others with love and dignity, regardless of who they are, what they think, who they love, how they think, or where they come from, we will help them, and you will come ever closer to achieving your aspirations of service. Be well, and congratulations to you on all that you have achieved and all that you will achieve. Thank you.
flipping through the script. Okay. Okay. Thank you, Dr. Gilliam, for that incredible speech. It is now my distinct pleasure to introduce Dr. William V. Ginobili, Dean of the Harvard School of Dental Medicine, and A. Lee Loomis, Jr., Professor of Oral Medicine, Infection, and Immunity. It has been my pleasure to get to know him over the last several years, and it is my distinct privilege to welcome Dean Ginobili to the podium.
Thank you so much, Crystal, for those kind words. And thank you, Dr. Gilliam, for such an inspiring message for all of us today. So, as we're here together to welcome the class of 2024, families, friends, and loved ones. So, class of 2024, you did it. Congratulations. So we're thrilled to be here to celebrate your accomplishments as graduates of the Harvard School of Dental Medicine and the Harvard Medical School. So in the interest of time, we've collapsed down our remarks, but I did want to give one quote from one of our graduating students who really epitomizes some of the best of this class and what you have all done through many different challenges, your amazing resilience, your dedication, and your caring to our students. And so she happens to be sitting here in the front row. Lisbeth Milagros Garcia said, during her white coat ceremony in 2020, we were all remote at that time, I shared that joining HSDM was far greater than anything I dared dream of. I realize now that there is nothing I would dare not dream. And so as we think about all of you going out into the world today, I hope that you're instilled with boundless confidence that anything is possible. Dare to dream big and be inspired by the connections and camaraderie that you found here at Harvard. All of us here today are so very proud of you and cannot wait to see where your dreams will take you. Congratulations, doctors. So now I would like to invite Dr. Sang Park, our Associate Dean for Dental Education, to the stage for the conferral of degrees.
That was beautiful, Dean Ginobili. Good afternoon. It is truly an honor to celebrate our amazing members of the Harvard School of Dental Medicine class of 2024. So our graduates are making their way to the podium, and I'd like to introduce the dental faculty who are assisting in the hooding today, and they are Drs. Aram Kim, Luis Lopez, Josh Christensen, Shailene Yamakami, Sam Coffin, and Fadi Coleman. So do you know that it is on this stage that they will be addressed as doctors for the first time? And it is so much more special because they are surrounded by their families and loved ones. Okay, the class, you look ready. Hey. Dr. Gerardo Andres Alvarez Mogoyan. Dr. Bridget Mary Bain. Dr. Noah Robert Brady. Dr. Abigail Marshall Braun. Dr. Tahi Chung. Dr. Sheridan Asa Dankwa. Dr. Jack Aaron Ferreira. Dr. Peter Fulmer, accompanied by his adorable children, Elise, Simon, and Jay. Dr. Lisbeth Milagros Garcia. Dr. Ana Lilian Garcia Castaneras. Dr. Yuying Guo. Dr. Vivian Ha. Dr. Kadria Elizabeth Hargett. Dr. Kelsey Jean Hebert. Dr. Jason Michael Zhuang. Dr. Young K. Kim. Dr. Abigail Julia Madeline McVicker. Dr. Joseph M. Montesano. Dr. Alicia Nanji. And her twin sister, Natasha Nanji. Dr. Sapna Nath. Dr. Temitope Aisha Oshilaja. Dr. Madison Lees Overby. Dr. Lindsay Knight Pius. Dr. Catherine Faith Simpson. Dr. Crystal Song. Dr. Lyra C. Valdez. Thank you. Dr. Tianchi Wei. Dr. Brent Meyer Whiting. Dr. Shosho Yang. Dr. Stephanie Rachel Yang. Dr. Chloe Sima Zana. And Dr. Zena Zhu. Congratulations, Harvard School of Dental Medicine, class of 2024.
It is now my honor to introduce the man of that needs no introduction, Dean George Daly. Dean Daly is the Dean of Harvard Medical School and the Caroline Shields Walker Professor of Medicine. Please join me in welcoming Dean George Daly.
Thank you very much. Good afternoon, everyone. I apologize for the stormy weather. Let me just say, as Dean, the rain is yet another problem that I'm criticized for not fixing. But class of 2024, congratulations. Your graduation is an extraordinary achievement. You are making us all very, very proud. Indeed, you are passionate, you are industrious, and notably, you are resilient. You started in the throes of the pandemic, and you've weathered crisis after crisis over the past 4 years plus. More recently, you've grappled with, and indeed, I dare say we have all grappled with, the conflict in the Middle East, the calamitous loss of life. We have confronted deeply and profoundly divided feelings on our campus. We've wrestled with the tensions inherent in defending free speech in a diverse community with passionately held beliefs, but not all the same beliefs. On diversity, we have been the subject of a targeted campaign from those who seek to undermine and invalidate our commitment to the tenets of diversity and equity, which we will defend as essential for us to be caring and competent physicians for all our patients. Many, many modern challenges are deserving of our attention. Humanitarian crises, absolutely. But also poverty, malnutrition, mental health, disparities in access to care, the climate crisis, and more. Please, graduates, funnel your hard-won expertise and training into these challenges, attending to them with empathy, patience, and humility. Now, attending to human suffering is a solemn responsibility, and it is embodied in the mission statement of Harvard Medical School to relieve suffering and improve health and well-being for all. So I encourage you all to embrace the call to relieve human suffering using your talents and all that you have learned at Harvard Medical School. So class of 2024, congratulations. I'm inspired by your intellect, by your passion, by your dedication, and by your pursuit of social justice for all people. May you thrive in your chosen careers. We eagerly await all the good that you will do. Now, this is the moment that you've all been waiting for, the medical students, many for many years. I'd like to invite the Dean for Students, Fidencio Saldana, and the Dean for Medical Education, Bernard Chang, as well as Terry Galutska, the HMS Registrar, to join me for the conferring of the MD degrees. You even make the comments? Yep.
All Harvard Medical School students are assigned to one of 5 academic societies. These societies represent learning communities, advising homes, and even social centers for our students throughout all of their time with us. And it's our tradition here at HMS and HSDM Class Day to have the advisory dean of each academic society, the senior faculty member who is responsible for overseeing the academic, professional, and personal growth of our students, read out the names of the students, the graduating students in their society. We'll go in alphabetical order. The first society alphabetically is the Walter Bradford Cannon Society, and the advisory dean of the Cannon Society is Dr. Sarah Fazio.
Good afternoon, everybody, and congratulations to the amazing Cannon class of 2024. I want to first thank our Hooders, faculty from our society, Dr. Daniel Kamen and Dr. Adara Landry. And I also want to preface this by saying, as much as it hurts me, I'm not going to shake hands or do any hugging so that we can get everybody graduated and out of here before we're thrown out. All right, without further ado, Dr. Julia Rose Biatini. Dr. Jonah Aaron Stark Blumenthal, my apologies. Also receiving a Master's in Business Administration, Dr. Pooja Chandrasekhar. Dr. Sun Young Chung. Dr. Sarah Ashley Cohen. Dr. Lexi Marie Kurt. Dr. Salvador Riley D'Addario. Dr. Kathleen Leslie Eng. Dr. Nicholas Freeman. Dr. Ethiopia Getachew. Also receiving a Master's in Business Administration, Dr. Simon Jonathan Gunter. Dr. Camber Lauren Hart. Dr. Zoe Anais Kibbelar. Dr. Jane Renee Kielhoffner. Also receiving a Master's in Public Policy, Dr. Ashley Shawazi. Dr. Tyler Lacomer. Dr. Tonatu Lievino Beltran. Dr. Victor Anthony Lopez Carmen. Dr. Somia Mazumdar. Dr. Emily Ann Nisan Strakos and daughter Adeline. Also receiving a master's in public policy, Dr. Adatumiwa Victor Owasheni. Dr. Ash Panicum. Dr. Matthew Quincy Parsons. Dr. Jocelyn Marie Rodriguez. Dr. Claire Russian. Dr. Trinity Russell. Dr. Dominic Delaney Schnabel. Dr. Andre Maurice Small. Dr. Rana Solomon. Dr. Virginia Sun. Dr. Gustavo Velasquez. Dr. Nathan William Watson. And last but not least, Dr. Michael Joseph Woodbury. Congratulations to the Canon Class of 2024.
Thank you, Dr. Fazio. The next academic society is the William Bosworth Castle Society, whose advisory dean is Dr. Jennifer Potter.
It is my great pleasure to present the Class of 2024 William Bosworth Castle Society graduates. And hooding our graduates today are Associate Directors Drs. Nikki Johnson and Alden Landry. Also receiving a Doctor of Philosophy, Dr. Sham Kiran Akala. Dr. Andrew Etheridge Amini. Dr. Margaret Grace Beezer. Dr. Sarah Elizabeth Blitz. Dr. Grace Ware Kavanaugh. Dr. Julia Jungju Cha. Dr. Andrew Raitren Chang. Also receiving a Doctor of Philosophy, Dr. Lucy Chen. Dr. Isabella Stewart Colochi. Dr. John Donlin. Dr. Julia Hope Amor Foot. Dr. Malini Marian Gandhi. Dr. Ruby Guo. Also receiving a Doctor of Philosophy, Dr. Tuna Jem Heyerle. Dr. Lynn Herr. Dr. Ariel S. Isaacson. Dr. William Juoming Lee. Dr. Ulysses Marquez Valenzuela. Also receiving a Master of Business Administration, Dr. William Bongo. Also receiving a Doctor of Philosophy, Dr. Chelsea Jordan Messenger. Dr. Lily Sparrow Murfakre. Dr. Matthew Kyler Mitchell. Dr. Gil Munkbater. Also receiving a Master of Business Administration, Dr. Sachin Logan Naik. Also receiving a Master of Public Policy, Dr. Lashira Taiz Nolan. Dr. Haley Sabina Novis. Dr. Stefan Henry Olson. Also receiving a Doctor of Philosophy, Dr. Maximilian Julius Pani. Also receiving a Master of Business Administration, Dr. Mario Vincenzo Russo. Also receiving a Master of Public Policy, Dr. Mezu Russo. Dr. Stephen Anthony Stearns. Dr. Christine Antoinette Zelios. Dr. Meghna Kasturi Vagwala. Also graduating with a Master of Public Policy, Dr. David Ezekiel Velasquez. Also receiving a Master of Business Administration, Dr. Razan Zaire Virji.
Thank you so much.
Dr. Tim T. Wong. Also receiving a Doctor of Philosophy, Dr. Catherine Alida Warren, and her two sons. Also receiving a Master of Business Administration, Dr. Mitchell John Paul Winkie. Dr. Raylin Fan Shu. Also receiving a Master of Business Administration, Dr. Bessie Shijing Zheng. Dr. Amina Ziad. Please join me once again in congratulating the class of 2024 Castle graduates.
I want you all to notice something. Look around outside the tent. With each name being read, a little bit more sunlight is coming to us. The next academic society is the William Augustus Hinton Society, and the advisory dean is Dr. Anthony D'Amico.
Thank you, Dean Chang. And for the students, the light represents hope. Share it with one another and your patients. Hooding the students will be Dr. Niha Trin and Dr. Anita Vanka, our associate advisors. Dr. Jared Mark Al-Swang. Dr. Jamie Beck. Dr. Sana Batul. Also receiving the Masters of Public Policy, Dr. Jalen Benson. Dr. Christina Michelle Bolineau. Dr. Haley Marie Butler. Dr. Josue Daniel Chinos. Dr. Cameron Elizabeth Comrie. Dr. Luis Enrique Cortina. Dr. Andre Dempsey. Dr. Daniel Doe. Dr. Julia Brittany Duval. Julia. Also receiving his Master's of Public Health, Dr. Dominic James Falcone. Dr. Dukman Yao. Congratulations. Dr. Rina Goswami. Dr. Roxana Hagiji Jat. Dr. Laboni Hawk. Dr. Olawa Basimi Sola Omotalani Ibi Kunle. Dr. Yuzhen Zhang. Dr. Matthew Christopher Johnson. Congratulations. Dr. Abigail Michelle Kempf. Dr. Felicita Bustos Cooper-Wasser. Also receiving the Doctorate of Philosophy, Dr. Stephanie Lee McNamara. Dr. Angela Marie Mercusio. Also receiving the Masters of Public Health, Dr. Mugana Nani Andita Mishra. Dr. Allison Elizabeth Mosier Mills. Dr. Aldous Harold Petracheeks. Also receiving the Masters of Education, Dr. Amina Rahimi. Dr. Bijal Grish Rajput. Dr. Rachel Marie Riordan. Dr. Anna Kristen Roselle. Dr. Sunjana Lakshmi Shri Kivasan, also receiving her Master's of Public Health. Congratulations. Dr. Lansing Leo Suguta. Dr. Vera Kate Tana Jarun. All right. And with two angels accompanying him, Dr. Ethan Robert Tenkati. Congratulations. Dr. Ornelia Jory. Congratulations, finally, good to meet you. Dr. Alan Swan Yang. Congratulations. Dr. Alexander Gordon Yearley. Let's congratulate the 2024 class, Hinton Society. God bless them.
Thank you, Dr. D'Amico. The next academic society is the Irving M. London Society. This society represents the students in the Health Sciences and Technology program, which is a unique partnership between Harvard and the Massachusetts Institute of Technology. The advisory dean of the London Society is Dr. Wolfram Gusling.
Congratulations, graduates, families, and friends of the Irving M. London Society and the Harvard-MIT Division of Health Sciences and Technology. Abby Amond. Alali Azir, graduating cum laude. James Dio, graduating summa cum laude. Dr. Christopher Michael Dietrich. Dr. Jonah Isaac Donenfield, graduating magna cum laude. Dr. Michaela Flores. Dr. Blake Hauser, graduating cum laude, also received a PhD from Harvard University. Dr. Sophia Hu, also received a PhD from Massachusetts Institute of Technology. Norman Javed also received a PhD from Harvard University. Dr. Tusha Vinod Kamath also received a PhD from Harvard University. Dr. Minji Kim, graduating magna cum laude. Dr. Patrick Linehan also received a PhD from Harvard University, and his daughter. Dr. Claudio Macias Trevino also received a PhD from Harvard University. Dr. Ileana Marustica, graduating magna cum laude. Dr. Eduardo Mori also received a PhD from Harvard University. Oh. Okay. Dr. Elizabeth Minton. Dr. Catherine Nabel Smith also received a PhD from Harvard University. Dr. Julia E. Page also received a PhD from Harvard University. Dr. Deborah Plana, graduating magna cum laude, also received a PhD from Harvard University. Dr. Sheridan Ray. Dr. Sarah Ann Rubin, graduating cum laude, also received a PhD from Harvard University. Dr. Jamie Erin Shade, graduating cum laude. Dr. Bryce Philip Starr. Dr. Hannah Jacqueline Sapari, graduating cum laude, also received a Master of Science from Massachusetts Institute of Technology. Dr. Max Louis Wallenstein, graduating magna cum laude, also received a PhD from Massachusetts Institute of Technology. Dr. Sarah Weiss also received a PhD from Harvard University. Dr. Oma Yagi also received a PhD from Harvard University. Dr. Catherine Young. I don't have the name. What? Oh, Dr. Allison Freed. Yeah. Dr. William G. Thank you. Congratulations, London Society Class of 2024.
Thank you, Dr. Gusling. And the last academic society alphabetically, as I know well, is the Francis Weld Peabody Society, whose advisory dean is Dr. Joya Mukherjee.
All right, congratulations to the graduates of the Francis Weld Peabody Society, Harvard Medical School, Class of 2024, and I'm adding to the weather analogy saying we're expecting rainbows with the sun coming up and the rain going away, and what a beautiful rainbow of diversity we've seen, and I appreciate all the speech and all the tolerance. Our first graduate was conferred a master's in public policy, Dr. Sara Abdallah Al-Zubi. Dr. Maya Ilana Weitzner Ben. Dr. Brian Ezequiel Benitez. Dr. Rose Madeline Berman. Also receiving a master's in business administration, Dr. Asil Beerer. Dr. Case Edward Brabham. Dr. Juliana Kathleen Coleman. Also receiving a master's in bioethics, Dr. Carlos Dos Santos. Dr. Jessica Lou Dugan. Dr. Alexander Rushad Farid. Dr. King C. Folk. Dr. Olivia Charlotte Khan Bozell. Dr. Kanika Kumali. Dr. Manoj Kunajraj. Sorry. Dr. Nicole Hannah Kim. Dr. Sienna Lee. Dr. Erica Eleanor Lynn Green, and receiving her diploma will be her mom, Dr. Laura Ellen Green, because Erica just had a baby. Congratulations, Grandma. Dr. Ria Malik. Receiving also a master's in public health, Dr. Jeremy Martinez. Dr. Anjali Jahnavi Mishra. Dr. Hillary Brenda Wynn. Dr. Wesley Robert Norland. Also receiving a master's in public policy, Dr. Dennis Delasi Ñaño. Also receiving a master's in business administration, Dr. Ellie Pott. Dr. Teja Sai-Kiran Dr. Sejan Polisetti. I apologize. Dr. Claire Margaret Quinlan. Dr. Natalie Sadlak. Dr. Samantha Jane Sadler. Dr. Hugh Carlton Shirley. Dr. Jessica Angie Sun. Also you're not the next person on my list. Also receiving a PhD? Also receiving a PhD, Dr. Dana Marie Vigu. Dr. Somita Mahok Sander. Also receiving a PhD, Dr. Danielle Joseph Weiner. Dr. Haley Lane Winstead. Dr. Brianna Joycelyn White. Also receiving a master's in public health, Dr. Rachel Eck Wittenberg. Dr. Azi Solomon Yirga. Also receiving a master's in business administration, Dr. Taylor Arthur Zabel. Congratulations to the Peabody Society class of 2024.
Congratulations to all the graduates. At the end, yes. We present to you, Will, join us. We're winging it up here, okay? We present to you the wonderful, fabulous, phenomenal Harvard Medical School and School of Dental Medicine class of 2024. Please give them a round of applause. There we have it.
For probably one last time. Congratulations, class of 2024.
Since the time of Hippocrates, over 2,000 years ago, healthcare practitioners have taken an oath to uphold the principles of the vocation to which they dedicate themselves. In setting forth these principles, the oath serves both as a contract with the community and as an affirmation of a deep commitment to the profession.
Being mindful of the debt we owe to the mentorship of those who came before us, while recognizing that our work will inform the practices of those who follow, we have created an oath drawing on elements both ancient and recent.
We now invite the class of 2024, the 2024 Oath Committee members to come up to the podium with us and as a class stand and articulate the ideals and principles that will guide our journey as physicians and dentists without exception.
Students, please stand now as we read the oath. Family members and guests, you may remain seated.
Okay. In our service as physicians and dentists, we vow, first, to do no harm. Above and beyond this, we vow to respect the dignity and autonomy of our patients, to care for our patients from all walks of life and identities, to listen to their stories with curiosity in the absence of judgment, to learn from their lives with humility. We are grateful to our patients for sharing their lives with us. We aim to continue learning and growing for the rest of our lives. We are not afraid to fail.
Vow to acknowledge human and institutional errors with humility and kindness, to question, experiment, and innovate, and to advance science, to uphold our field's ethical principles with integrity, to provide the best patient care we can and know of, and to commit to the lifelong pursuit of learning. We have not arrived here alone, and we thank all who nurture and support us along the way.
We vow to take care of ourselves and the villages that have carried us, to uplift each other in times of both celebration and loss, to build the collective resilience and strength of our community, to extend ourselves the same respect, compassion, and empathy that we extend to those around us. Our communities call upon us to advocate for our patients. We are not spectators, but active agents in the pursuit of justice.
We vow to answer that call, to advocate for the voices who have not been heard, to advance equity in healthcare, to thoughtfully respond to change. Together, we will work toward a future with greater hope and less suffering.
We now offer a moment of reflection for all to take their own personal oaths.
Thank you.
All right. Before I introduce our next speaker, I just want to acknowledge the fact that we have taken an oath to uphold the values of our profession, which include values of social justice and equity. I believe that our class is truly special because we have weathered so much together, from pandemics to the racial backlash that we're experiencing today, backlash against trans youth, and so much more. And I think that our class knows better than most that our oath and opportunity to heal is dependent on our understanding of socio-political context. So as we take this oath, I hope that we will also have the moral courage to call out the fact that the healthcare systems in Gaza have been disseminated, and also that some of the batteries that run our medical equipment are related to the ongoing injustices in Congo, and that those that we elect and put into office are also implicated in the complications in Sudan and Haiti. So with that, I want to bring forward our next student speaker, who very much so embodies the values that I hope that the class of 2024 can in our future profession. Tyler LaComer was born in Rochester, New York, and grew up in Stratford, Connecticut. He is the class president of the class of 2024 and serves on the student leadership team for HMS's newly formed Office of Community-Centered Medical Education. He will be training in anesthesiology at Columbia New York Presbyterian Hospital in Washington Heights, where he hopes to continue working to expand access to healthcare for historically underserved communities. This is the friend that you can call at 3 a.m. in an emergency, the friend that will celebrate you during your highest of highs and your lowest of lows, that friend that will stand by you for justice despite all the obstacles in his way. We call him TLC because that boy can dance too. I am so proud to introduce my friend, fellow president, and nephew, TLC.
Thanks, Auntie. So for those of you who I haven't met, again, my name is Tyler LaComer. I'm the product of my teacher's advice, my mom's support, my shared experiences with my friends, and my thousands of mistakes. And as of today, I'm a doctor. But this was not always the path that was in front of me. As many of you know, black male physicians are few and far between. Ooh. Things are out of order here. What's up? We gonna get there. We gonna get there. All right, we got it. We got it. As many of you know, black male physicians are few and far between. I was 18 years old by the time I met another black man even interested in the medical field. And so for most of my life growing up, my vision of the future was scattered. It really changed by the day. My best friend wants to be a baseball player. Me too, even though I've never really held a bat. The girl I like wants to be an artist. Me too. I'm really good at painting by numbers. And I even applied to a high school entirely dedicated to the field of marine biology, which my mom immediately said no. Mother knows best, for sure. It was not until my sophomore year of high school that I found true direction, or rather, it found me. That year, I took part in a health career pipeline program, a weekly visit by a teacher no older than 23, the same age I was at the beginning of medical school. His purpose was to expose us, a class of primarily underrepresented students, to the vast world of medicine. And sure enough, I spent the whole year flipping through the career book they gave us, just thinking, look at all these ways that I can help people. In the year before medical school, I came back to that program, but this time as a teacher, because I know just how much life can change when someone tells you that this is for you too. This is for you too. When the Supreme Court struck down affirmative action not even a year ago, I felt like this message was lost on a grand scale, as if the ramifications of hundreds of years of atrocity were over. I remember Ruby Bridges, the first African-American child to walk into a formerly all-white school in Louisiana back in 1960. I remember all of the black and white photos of the event, which made it feel so ancient, even though color photos had been around for decades at that point. Then I remember my dad, who grew up in the civil rights era in Birmingham, Alabama, is actually older than her. And speaking of Birmingham, I remember learning about the bombing of the 16th Street Baptist Church in 1963. 4 children were killed, the youngest of which was 11. My dad was 9 at the time. These events are just a singular generation away. And so many people today feel that pain in where they live, where they can get food, and what education is available to them, all of which play a major role in their health. These historically ingrained parts of life that drag down the overall health of whole communities are constantly on my mind. This, for me, is what puts care in healthcare. And we all have core motivations that drive us in this career. And if you're like me, maybe you felt that this career often does not leave room for that. That the pressure to be efficient forces your drive to the sidelines, unable to find its place in the minutes you have with the patients in front of you. And if you're like me, maybe this is one of the scariest things about residency. But even with the state of our healthcare system, our classes always inspire me by actively and wholeheartedly making that space anyway. Not just for each patient in front of us, but in community with each other when we need a reminder that this is for us too. For the people outside the hospitals who live just blocks away but can't access the system for countless reasons driven by centuries of abuse through America's history. For people across the nation who we've never seen or met, people who are quite literally fighting for their lives to have access to safe abortions, to protect their children from gun violence, to survive an encounter with the police, or to have pride in who they are. And for people across the whole globe who day in and day out face the horrors of war, occupation, and oppression, from Sudan to Congo to Palestine and beyond. We make space and care for people internationally simply for the fact that they are people. And we did this often without the power that comes with an MD. But now that it's here, we can only go higher. To briefly quote the late Toni Morrison, if you have some power, then your job is to empower somebody else. And this is exactly what I think this career needs to be and who we need to be. I am here because someone taught me that this is for me. In our class, we've held each other up by reassuring that this is for us. And our job now is to empower our patients and communities so they know that this is for them too. And that empowerment will look different every day. It will be big, like the thousands of college students across the nation who camped, who hosted teach-ins, just to show the world that we do not believe genocide has any place in this world ever. And that empowerment will be small too, such as signing on to a petition or a letter for a cause that you feel is just. But regardless of how it looks, it is our duty to share the power we now have and to lead with our whole passionate selves. Because whether you are advocating for changes in health policy, spreading awareness of silenced voices worldwide, or just showing one single high school student that they too can be a doctor, there are countless changes to be made for all of us. Thank you, class of 2024, and congratulations again.
It is now with great honor that I introduce the Harvard School of Dental Medicine Class of 2024 student speaker, Sapna Nath. Sapna is from Long Island, New York, and graduated from the Wharton School of the University of Pennsylvania in 2019. At HSDM, she developed her passion for dental innovation and the intersection between entrepreneurship, business, and dentistry. Sapna has been actively involved in research and is a leader on campus, notably as the president of the Harvard Dental Class of 2024 and the co-founder of the Harvard Dental Innovation Society. She is our class's strongest advocate and has been extremely dedicated to bringing our class together through class events and has worked tirelessly as a go-between between faculty and the student body. She is always there to brighten your day with bubble tea and with a smile. She will be returning to the University of Pennsylvania for her orthodontics residency this summer. Her remarks today are entitled A Trip Down Memory Lane. It's my pleasure to welcome my dear friend, Sapna Nath.
All right, okay. We're all dry, have our degrees, so thank you so much. It's so great to be with you here today. Congratulations to all the amazing graduates. Behind this moment are countless hours of hard work that didn't just start 4 years ago. Today is the culmination of years and years of commitment that goes all the way back to AP exams in sweaty high school gyms, long nights in the research lab, and Orgo finals where the retrosynthesis failed to synthesize. We have worked, studied, and dreamed our way here. And most likely, we are not the same people who started this journey so many years ago. But we all know it wasn't just us alone. So let's give a round of applause to all our family, friends, mentors, and loved ones who have supported our aspirations, even in the moments where we questioned if we could make it. As we come to the end of our 4 years together, I thought it might be nice to take a trip down memory lane. Dental school is a very unique time. You are simultaneously a student, an artist, an engineer, a clinician, a lab technician, and let's not forget, your own receptionist. In year one, we shared the classroom with our medical school classmates, except it wasn't a normal classroom. It was our bedroom. We met each other in Zoom school and in breakout rooms in the midst of a global pandemic. We tried our best to add normalcy in a very not normal world. Then we arrived in Boston during a snowy winter, eager to make up for our lost time. We had to learn to accommodate a morning commute that was longer than the 10-second walk from our beds to our desks and wore actual pants instead of pajamas. But fortunately for us, the comfort of scrubs was just around the corner. In year two, our class spent countless hours together in room 109, sitting in lectures and definitely not doing the Wordle. We learned the fundamentals of dentistry, from how to make the best crowns to attempting to understand the complexities of dental occlusion. The horrors of unsupported enamel were drilled into our minds as we learned to drill on plastic teeth. It's safe to say that for my classmates, getting to this point was a collective effort. And we relied on each other in some pretty unconventional ways. We tested each other's gag reflex, learning to take impressions. In Stab Lab, we learned to give each other numbing shots. By administering them to each other, and as you know, practice makes perfect, and we assisted each other through our first patient intake appointments, which happened to last just a short 4 hours. And we would not be here today without our patients in the student clinic, who sat through 3-hour fillings, 4-hour crown preps, and 6-hour root canals when all they wanted was just a cleaning. Without their patience, much of our learning and progress would have been impossible. In dental school, as we do procedures, we have to get faculty approval between different steps. What often ensues is a long train of dental students following around a single faculty member, not unsimilar to the geese you see walking in a line down Avenue Louis Pasteur. But it was in these lines that we became closer, catching up on weekend plans and big life events, and even for a mid-clinic pep talk. In year three, many of us perfected the classic dental student poker face. When you do a procedure for the first time, and you might just be a little bit overwhelmed, and you just can't get that final impression right, and the clinic is closing in 10 minutes, and your patient is leaving for a 2-week cruise. But we knew we could always count on each other to be each other's crunch time assistants and share that locked eye glance where you silently communicate all your deepest fears without even saying a word. And speaking of fears, you know how people say that the spider on your wall is more afraid of you than you are of the spider? Well, we learned to face some of the most terrifying things in dentistry: 3-year-old children. And in the pediatric clinic, while some of us were running towards these children like Lisbeth and Yu Ying, most of us were running away screaming. Year 4 was licensing exam after board exam, after licensing exam, after research deadline and case presentation. Even as we flew around the country and started planning our next steps, we spent many a late night in the lab making dentures. They say, a millimeter is a mile in dentistry. They say a millimeter is a mile in dentistry. And setting teeth at 10 p.m. in the basement of the school, Bunsen burner and hot wax in hand, a millimeter felt more like the grueling 26.2 of the Boston Marathon. And it would be a lie to say we didn't cinch a hair or two along the way. Up until the very end, we helped each other with our clinical requirements, from extractions and periodontal surgery to the elusive implant crown. With some of us even sliding in that final requirement this past Tuesday, the perfect buzzer beater. Today, we don't have to pretend that everything in the last 4 years was easy, because it was not. However, today, we have the ability to give power to some memories over others. We have the ability to let go of the disappointment when you send your case back to the dental lab for what might have actually been the 10th time, and remember the confidence you gave your patient with their new smile. Let go of the frustration of when your morning appointment runs late, and now you only have 10 minutes for a vending machine lunch before running back up to the clinic again. And remember sharing the perfect sandwich in the Courtyard Cafe with your friends. And let go of the loneliness of walking back alone at night in the cold Boston winter. And keep hearing the laughter during our walks together in our post-clinic lab session coffee runs. Although much of our life over the past 4 years has been defined by being a dental student, we have taken time to foster diverse interests and identities that have kept us grounded in school. So I would like to give you a closer look into the HSDM class of 2024 outside the clinic. We have our gym rats like Abby, Lindsay, Gerardo, Noah, Brent, and Sheridan. This ironically also includes half of our class going into oral surgery. We have busy parents like Peter. We have content creators Alicia and Natasha, our marathon runner Madison, our artists and crafters Crystal, Abigail, Stephanie, and Vivian. We have solid core enthusiasts Kat, Kelsey, and Kadria. We have foodies Chloe, Anna, and Jason, ice skaters and rowers, Sophia and Bridget, dancers and travelers, Jimmy and Dahi. We have our comedians, Jack and Aisha, plant caretakers, Lara and Joe, and our bikers, Jenna and Glory. Also, just look at these hobbies. Can you find a more athletic bunch? Sometimes, when people think of the dentist, they think drill, fill, and bill. But over the last 4 years, our tiny class has made huge strides at the forefront of dentistry as innovators, researchers, scholars, and advocates. We have learned to put patients first and meet them where they are. Procedures we once read about in our books and once seemed daunting now take us minutes. And so, it's been a privilege to see our pajama-wearing, Zoom school-attending group of 33 become truly incredible, creative, and compassionate clinicians and leaders. Now it's time for us to part ways and make Dr. Levi proud by sharing that stationary bass bristle technique with each of our future patients. I cannot wait to see the incredible impact each one of you will make on the world. And I know that whatever corner of the country I am in, I will always have someone to turn to for some free dental care. So thank you to the amazing class of 2024 and to my dental school family. We did it.
Our next student speaker is a passionate Missourian and Midwesterner from afar, whose academic interests include improving subspecialty care, particularly in rural areas. Coming to us from the University of Missouri-Columbia, or Mizzou, this HMS student co-founded FARM, a group dedicated to advancing rural medicine. Following graduation, she is excited to begin urology residency at the Brigham and Women's Hospital. If you had the privilege like I do to know Jane, you know that she is someone who lights up any room that she walks into and reminds us of the little joys in life. She is the fierce woman surgeon that we all aspire to become. And she is the friend that's always there to listen to you. Let's welcome to the stage, Jane Kielhofner.
Good afternoon, everybody. To friends, family, and all of you who have been swindled into going to yet another graduation today. My name is Jane Kielhofner, and I'm honored to be speaking to you. And as I stand on the cusp of a new beginning with all of you, some of you, like me, might be tempted to think back to the beginning of our medical school journey, approximately 35 new gray hairs ago, our medical school interview. In my interview with Dr. Robert Mayer, I asked him my usual canned interview question: what's something that the students here don't utilize enough? His answer was this: many students don't realize that the person sitting to your left and to your right in lecture have done a great deal to get here. People have grown up in unique circumstances and achieved huge things. In medical school, you will learn as much from your classmates as anyone else. That is what students here do not utilize enough. I was immediately transported to the back seat of a silver Chrysler 300. I grew up in Southwest Missouri with my parents and 3 siblings. Because both of my parents worked full-time, my siblings and I spent our primary school years carpooling home with other families. But in second grade, my parents instead asked my neighbor to drive us home. However, there was one issue. That neighbor was my school's reputedly evil 3rd grade teacher, Mrs. Southern. Mrs. Southern was rumored to keep a bullwhip in her desk just in case there was an intruder. She taught cursive multiplication and division with an iron fist. Allegedly, not even the biggest teacher's pets, most of you here today even, could not escape her wrath. And the way I saw it, my parents had just signed me up for a ride home with a villain in her getaway car, which just happened to be a silver Chrysler 300. The first day, I was very nervous. 13 minutes into the 15-minute drive, I needed to break the silence or else I was going to explode. Did you know I'm trying to learn piano? I managed to squeak out, "Wow," she responded, and the car went silent again. When she pulled into the driveway, I was sweating. Her car had barely rolled to a stop before we all bolted inside and waved in the window to signal that there was no serial killer in our home. Then, for the next 6 years of elementary and middle school, Mrs. Southern drove us home every day. Shockingly, our conversations transitioned from nearly 15 minutes of silence to a meaningful relationship. I learned a lot about her in those years. She would share little tidbits about her own childhood, when her kids were growing up, or what her grandkids were up to. She had survived a tornado blowing through her living room in Oklahoma. I've grown a lot since my teenage attempt at the piano, but even starting medical school, I struggled to be comfortable in long stretches of silence. Many of you probably recognize this. After so many hours on Zoom, it was exciting to actually get to talk to real-life patients in person. I had so many questions for them, so much I wanted to learn. But what I learned from watching my mentors and my peers, to whom I look up to, was that patients shared the most when their provider let them sit in silence, waiting patiently for the patient to not just share pertinent positives and negatives, but what was truly on their mind, why they were hesitant to start a medication that we perceived as incredibly safe, why they were so eager to leave the hospital when the team recommended staying. Please excuse the irony of a speech talking about silence, but this lesson on silence is one of the most important lessons I have learned from you, my classmates, not just from being on floor teams together, but because we all sat in the front seat of each other's Chrysler 300s. We learned about our classmates' hardships, their journeys to medicine, their culture and passion and families. We heard about each other's personal experiences with chronic illness, indigenous culture and healthcare, rural health disparities, being under or uninsured, facing racism and bigotry. And I will never forget these lessons as I serve my patients. I hope you won't either. We also learned some other things along the way, like how to dissect a raw chicken leg over Zoom when there is a global pandemic preventing you from being in the anatomy lab. I hope Dr. Stearns watches this. However, there was one lesson that no one could quite grasp: the difference between an anastomosis and a fistula. It was a fateful day of Zoom class in that September of 2020, and all of our brains were synchronously melting as the fifth person tried to ask a clarifying question on these concepts. We never reached a solid conclusion, even though many follow-up emails were sent. Well, a few years later, I'm here to cap off our medical school experience with one final lesson from a classmate. A fistula is an abnormal connection between two epithelial line surfaces, while an anastomosis is the union of parts or branches so as to intercommunicate or interconnect. Does everyone got any questions? And I can't help but think that the definition of anastomosis is symbolic for what we've become over these past 4 years. While we've learned about and from one another, we've become interconnected permanently in some way, no matter how far we go from this very warm, very moist quadrangle. We have found connections against all odds, at mask fittings as we recited the Rainbow Passage, our white coat ceremony 6 months into having a white coat, learning how to take a pulse on the closest thing to us with a pulse, and how to pretend we've seen the optic disc with our ophthalmoscope. Unless you're going into ophthalmology, then you totally saw it. I lost my place. Okay. With every passing day, we formed anastomoses by learning about and with one another, something we will come to do every day with our fellow physicians, healthcare colleagues, and most importantly, from our patients. And so, this is a thank you to the class who has taught me when to prize silence and when to speak up. A class that fully lived up to the expectations set on interview day by Dr. Robert Mayer. And I hope you all continue with the same spirit of looking for the human stories in everyone you meet, just as you've done the past 4 years. To put it simply, I hope you never lock the door of your Chrysler 300. Thank you.
Well, as we have all gone from dangerously wet to dangerously hot, we are approaching the end of our ceremony. But before Dean Daly comes to give closing remarks, I have two very positive, very happy announcements for all of you. First, we are going to take a class photo on the steps of Gordon Hall right after this ceremony, now that the lighting is favorable. And second, for those of you in the audience, there is still lunch food available in the back, and we recognize that many people shuttling back and forth weren't able to get it earlier. So a photo on the steps of Gordon Hall right after this. Lunch is still in the back. Dean George Daly.
Okay, well, I want to recognize the remarkable staff that made this day possible, but also that supports us every day at Harvard Medical School. But in particular, I want to recognize Bill DeSimone, who is the HMS security manager. Today is Bill's 30th commencement at Harvard Medical School and his 70th birthday. Let's give him a round of applause. Thank you. Thank you, Bill. Thank you for all you do. So it is freely and joyfully and with honor that we now send you out into the world to practice in good faith that for which you have so diligently trained. So let me be one of the first to officially welcome you, my fellow doctors, into the profession. and wish you long, noble, and productive careers. Congratulations on this fabulous achievement, and enjoy the rest of the day.